Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. The nation's commercial capital COVID-19 response strategy hampered by non-compliance to prevention protocols. Yobe Primary Healthcare Board seeks support of traditional institutions for COVID-19 mass vaccination. And New Zealand rules out lockdowns, tightens curbs as it prepares for Omicron outbreak. Thank you for joining us. Now, 57% of the eligible population vaccinated with the first dose in Nigeria are from states in the northwest and southwest zones. According to the National Primary Healthcare Development Agency, 5 performing states on the COVID-19 mass vaccination campaign in Nigeria are Nasarawa, Jigawa, Ogun, the FCT, Kwara and Osun states. So far, while over 5 million of total eligible persons targeted for the vaccination are fully vaccinated, just a little over 13 million eligible persons have received their first dose. Here's more on the pandemic update.
230 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 13 states and the FCT. That's an increase from the figures reported earlier. Lagos accounted for the highest number of cases with 115 infections. Gombe had 29, FCT 24, Imo 20, while Rivers registered 10 cases. Ondo, Kano, Abia, Kaduna, Oyo, Kebbi, Ogun, Borno, and Jigawa states logged a single-digit infection. The total confirmed cases in Nigeria now stands at 251,571. The report also includes a backlog of confirmed cases from Abia, Kebbi, and Borno, a backlog of discharges from Abia and the FCT, as well as 0 cases from Ekiti, Nasarawa, Osun, Plateau, and Sokoto states. 341 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 225,280. There was 1 additional death recorded in the last 24 hours, raising the fatality toll to 3,117. Currently, there are over 23,000 active cases in Nigeria, while more than 3.9 million samples have been tested so far. Over 13 million of eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while more than 5 million of the population have been fully vaccinated. The total global confirmed cases have surpassed 337 million, while deaths are beyond 5.5 million.
The man in charge of Microfinance and Enterprise Development Agency in Ekiti State has denied claims that a certain COVID-19 fund is being used to woo delegates ahead of the forthcoming governorship primary of the All Progressives Congress, APC. Now, some social media rumors have it that the government agency has been promising delegates some World Bank-supported COVID-19 grants if they vote a candidate preferred by the government. The agency's helmsman says the federal government COVID-19 financial support schemes are not in progress at the moment, as he clarifies that he's not under any instruction to use the office for political ends. He also insists that the state did not give any group an undue advantage while COVID-19 support fund lasted.
COVID loan has since closed. It was a scheme put up by federal government to cushion the effect of the pandemic in 2020. And it came in 2 tranches, and this had since closed since October last year. So it closed October to be precise. So as saying that people are just coming to apply is far from the truth. The portal has since been closed. The portal was open in 2020. Then in 2021, that was the CBN came up again that the portal is open again for people to apply, because when they noticed that it really supported businesses across the 36 states, so they opened the portal for people to apply, and people applied online. The only thing we did as an agency was to ensure that we do enough sensitization of people across the 16 local government, because, like I said, it is a relationship between Nice Tri Microfinance Bank, central bank, and the individuals. Like I said, people that applied when COVID-19 was on board were attended to, and those people that requested for maybe for the COVID loan, if they've not benefited, I'm sure that is not from Ekiti State, because like I said, it's for the statistics state, and I'm sure by the time that scheme comes up, they will be attended to, and those people that didn't benefit from the COVID loan, that the answer to why they are not benefiting lies with the National Microfinance Bank and CBN.
Still in the southwest, the fourth wave of COVID-19 infections in Nigeria began mid-December with Lagos as the epicenter. And for the first time, the country was getting more than 1,000 cases on most days. Now, the festive season encouraged more human traffic, most of whom did not observe the prevention measures in face of a more transmissible variant, the Omicron variant. Our correspondent Mirialade Yusuf reports on the situation in Lagos.
When the fourth wave began, Nigeria recorded the highest number of cases than at any other time during the pandemic. As of January the 14th, Lagos, the epicenter, had confirmed over 97,000 cases and 761 deaths, more than any other state in the country. According to the tables, there are over 16,000 active cases within the state. Yet, at Ojota and Ikeja, densely populated areas of Lagos State, people walk about without masks or physical distance between each other. Bus conductors of both publicly and privately run lines don't seem to mind the non-compliance.
I feel that coronavirus, as it is being hyped in Nigeria, is not supposed to be so.
I went to a station. I saw one of the boss, as a police, the Oga, they're not putting on face mask. And they are, in the midst of people.
I left it at home. I forgot.
Only a handful of people are seen with properly donned masks.
Even I have taken my vaccine. I still put on masks because I believe I don't really can still contact it.
A center in the metropolis where vaccination is taking place. But some prefer to abstain.
Vaccination? No.
Because I've been busy.
I feel when they have other ailments in their body, the vaccine will trigger it out. And after a few days, they are okay. So and I'm here this morning to get my booster dose, which is after 6 months.
On a visit to the infectious diseases hospital at Yaba, our cameras were not allowed to film, but Channels Television noted some activity in the hospital, most of which, according to the Commissioner for Health in a previous statement, is now dedicated to COVID-19 management. The Lagos State University Teaching Hospital is the next port of call, where only one patient is still in its center. The Chief Medical Director says that the state never dropped the ball on COVID-19 management and only improved with the provision of vaccines.
Protecting our health workers with PPEs, ensuring that our clinics are not overcrowded, and as we speak, we have about 80% compliance in vaccination of our health workers.
When asked about how to prevent vaccine wastage and improve on vaccine acceptance, he speaks enthusiastically about research and indigenous vaccine production.
There is no reason why local vaccine production should not have been established in Nigeria. All our research centers should have now been adequately funded, and equipped.
However, some work needs to be done to become a vaccine manufacturing nation once again.
If we are matured at least level 3, there are 4 levels. Then Nigeria can manufacture our own vaccine. That is the regulatory aspect of it.
New infections per day are dropping, the bulk of which, according to the CMD of LASUTH, are being handled at IDH Yaba and Gbagada General Hospital. But beyond management at hospitals, it seems the state government has its work cut out for it in the process of vaccination and prevention. Mary Alale Yusuf, Channels Television News.
And researchers in the Netherlands have analyzed the mutations of the Omicron strain. They've calculated that it is sufficiently different from its predecessors to be the first of a new group of SARS-CoV-2. However, the authors warn of future variants which may make vaccine uptakes necessary? Well, joining us to talk more about this, Professor Ibekwe, Titus Ibekwe, ENT surgeon, president of the Foundation for the Sick and Health Education. He joins us from Abuja studio. Thank you for joining us on the program.
Thank you for having me.
Professor, what do you make of the unique properties of the milder Omicron variant, and if it changes the game in the pandemic since it was first detected?
Yeah, I think the last is yet to be heard about Omicron. Things that are known, basically the transmissibility, everybody is talking about that is real. So it can be easily transmitted from one person to the other when you compare to the previous variants, Alpha, Delta, etc. However, we know that the virulence is not as severe when you compare to these previous ones, especially the Delta, which is preceded this particular variants. But again, there is an interesting aspect of this that researchers are looking at right now. If, as we know, the rate of infection or transmissibility of this is very high, is spreading very fast across all nations, and very fastly displacing the previous variant, which is more virulent. That means that there may be a good news somewhere, because ultimately the old variants will be completely displaced and taken over by Omicron, which is a lot milder when compared to the previous. And transmutation is a continuous process, and who knows where this will lead us to. If it leads to even a milder form of it, that means that gradually, over time, this may fizzle out. And since so many people following this very high infectivity rate are getting exposed to this, that's how level of herd immunity is also being formed, among the populace worldwide.
But what about the fear that this might mean, Professor,
protection?
What about the fear that this might mean more vaccines uptake?
Yeah, that is very true. That area is not yet well clarified. But the reality is that right now we know that the vaccines are still efficient and effective against this variant. And that's why people are encouraged to go ahead and utilize the one present now, the booster doses, to have them. If you have not completed the doses that you have had, you go ahead and take in that while researches continue. Virus infection is not something that circles out within a day. It needs to apply every facet of public health, measures which involve the all-inclusiveness on the part of the health caregivers, with the populace, the patients, everybody doing what is right in order to be able to roll out and push out this virus infection finally, as until the last person within our confine or within our zone is free of coronavirus disease. I can tell you that the entire people within the same environment is not free. So despite having your vaccines, the non-pharmaceutical measures still very important, so that we apply all measures necessary, put them together, and when we do this, we'll be able to get the maximal effect, and that will help us in reducing even the length of period that this will still be within circulation among the human race.
Professor, always a pleasure having you join us. Thank you for joining us on the program. Professor Titus Ibekwe is an ENT surgeon, president, Foundation for the Sick and Health Education. Thank you for joining us on the program.
Thank you, Millicent, for having me once again.
Still ahead, Yobe State seeks support from traditional institutions for COVID-19 mass vaccination exercise. Please stay with us. Welcome back. The Yobe state government is embarking on an advocacy visit to 14 emirate councils across the state in order to seek support from traditional leaders in the ongoing COVID-19 mass vaccination in the state. Through the Executive Secretary, State Primary Healthcare Management Board, this was necessitated by the recent low performance by Yobe State in getting the targeted population vaccinated in the ongoing campaign. In all the emirate councils visited, Dr. Kundi Machina pleaded with the emirs to help talk to traditional and religious leaders in their councils to educate and enlighten their people on the importance of the vaccination. While responding, the Emir of Fikka, who also doubles as chairman, Yobe State Council of Chiefs, he assured the Executive Secretary that his emirate council would work closely with the local government primary health care teams and ensure continuous mobilization of the people of Potiskum town to come out for the COVID-19 vaccination. Yobe State is now ranked 14 in the country in the ongoing mass COVID-19 vaccination drive, and this is moving away from its 32nd position, a record the state government wants to improve. And over to the United States, people who had previously been infected with COVID-19 were better protected against the Delta variant than those who were vaccinated alone. Well, this is according to California and New York health officials, suggesting that natural immunity was a more potent shield than vaccines against that variant. Meanwhile, mask wearing is still encouraged by the Biden administration to fight COVID-19 as the core of America is being challenged by the fourth spike of the virus. Our Washington correspondent Maria Bird reports.
As the Omicron variant spreads swiftly across the U.S., the Center for Disease Control is recommending that all Americans wear the most protective mask as possible.
We also have helped make sure that high-quality masks are widely available in ample supply at affordable prices, sold online and in stores. But I know that for some Americans, the mask is not always affordable or convenient to get. So, next week we'll announce how we are making high-quality masks available to the American people for free. I know we all wish that we could finally be done with wearing masks. I get it. But they're a really important tool to stop the spread, especially of a highly transmittable Omicron variant.
I've been saying since day one, if they could make these available to everyone on the planet, I personally believe that every problem that we had wouldn't be here at this particular time. Now, certainly, these weren't available in abundance back in 2020, but they are now.
Masks become vital as the U.S. struggles through the fourth spike of COVID-19, which has impacted the supply chain, causing grocery store shelves to be empty.
There's no meat, no toilet paper. It's just crazy.
What we're dealing with right now is we had a supply chain that was kind of already at its breaking point, and the Omicron wave has been really devastating in terms of a labor impact. We don't have a food shortage. We do have a labor shortage.
Along with supply chain challenges, the U.S.'s moratorium on tenant evictions due to the economic impacts of COVID-19 is set to expire in many states. This will be devastating for many Americans.
I am prepared to do whatever it takes to help protect my neighbors who are most at risk of being homeless because the governor won't act to provide stronger tenant protections to tenants.
While COVID-19 has been deemed a health emergency, the impact is far-reaching and it will take years to rectify. From Washington, Maria Bird, Channel Television News.
Well, let's go over to the United Kingdom, where Prime Minister Boris Johnson says cases are falling and the Omicron wave has likely peaked nationally, meaning rules can now be eased. Well, to talk more about the science of that, Dr. Peter Moesi, Research Fellow, University of Aberdeen. He joins us now for more. Welcome to the program.
Thank you for having me.
All right, good to speak to you this year. Now, is the UK government being reckless, as some have said, by saying COVID-19 mitigations, are lifted as soon as next week?
Yes, so I was kind of surprised to hear that yesterday, and I think we kind of we're in a place right now where that kind of decision should be kind of withheld. We know that we're in the middle of Omicron. We also know that we're in the middle of the winter period, and people are going to spend more times indoor. And we know that when it comes to the vaccines, when it comes to the virus thrives effectively in an enclosed environment. So what I think the government should have gone on to encourage the people to do is, at the very least, to use the right face mask, which is the N95. And maybe by the first week of summer, we can implement this current policy they are trying to push right now. So for me, I think it's a kind of hasty decision to say, you know what, when it comes to the use of face mask, social distancing, physical distancing, and what have you, we're going to relax those particular measures, which have worked excellently well in the early days of this pandemic to this moment.
So if, you have a few scientists who are wondering why this decision has been taken, and there are others saying that, this might overwhelm the NHS, where is this science coming from? And also, this also speaks to perhaps what the science is saying about the future of the pandemic in England.
Yes, that is very correct. Some scientists are actually worried about this policy because we know that when it comes to Omicron, you have increased level of transmissibility. So if you're going to have a population who are highly infected, it means that you're going to have a high level of morbidities among your population. We've seen that when it comes to the SARS-CoV-2 virus, it has the capability to infect the olfactory system. And the olfactory system is responsible for your smell and taste, which is a region of the brain. That same region is implicated when it comes to Parkinson's disease. So when it comes to Parkinson's disease, you have a protein that is known as the alpha-synuclein that is present in that same olfactory system. And a recent study that came out in the American Chemical Society of Neuroscience, they were able to demonstrate in a test tube experiment wherein they say when you infect a particular cell with the SARS-CoV-2 virus, it has a capability to drive the aggregation of this particular alpha-synuclein to amyloid fibrous. And this particular mechanism is responsible when it comes to Parkinson's disease. And also we know that that same particular driver of this particular protein in that particular experiment is a nucleocapsid. Now, when it comes to the vaccines, we know that the vaccines has a capability to stop first the entryway of the virus into the host, which is the S1 and the S2 domain of the spike protein. And also this particular virus, once it gains access into the human host, that is when you have the nucleocapsid being released into the cells to drive the replication. So we have the vaccines already with the capability to stop that. But when you have a policy that allows people to congregate, that allows people to go about without the use of face mask and all other non-pharmaceutical interventions, it means that you're going to have society that are going to be infected over and over again. And once you have this reinfection ongoing, you may have society when it comes to their brain faculty being affected. So in the long run, we can't really tell the implication of SARS-CoV-2 in our own population in the UK. And that is why when it comes to this particular pandemic, I think we should be very careful in the way we roll out our policies, because this sort of back and forth policies from the government is actually creating a confusion within the populace. And this actually is not really the way science should be demonstrated to the general public. So for me, when it comes to the science, first and foremost, we should encourage our people to go on to get vaccinated to limit the viral load. So once you're vaccinated, we know that the vaccines do have the capability to drop significantly the viral load in vaccinated individuals compared to the unvaccinated. When it comes to the booster dose as well, you stand a better chance as well to also reduce the level of infection and effectivity of this virus as well.
We appreciate your time and insights into the issue. Many thanks, Dr. Peter Imoesi, Research Fellow, University of Aberdeen. Thanks for joining us.
Thank you for having me.
And all of New Zealand will move into the red traffic light system setting if the Omicron strain of COVID-19 starts spreading in the community. And this is what the Prime Minister Jacinda Ardern has announced. Well, here's more on the global COVID-19 update.
The Russian capital reported a record pandemic high of 11,557 new COVID-19 cases in the last 24 hours. Authorities say that the daily nationwide number of new infections also rose sharply to 38,850. New Zealand's Prime Minister Jacinda Ardern has announced that restrictions will be tightened across the country if there is a community transmission of the Omicron variant of the coronavirus, but rules out any lockdowns. Speaking at a news conference, the Prime Minister says the country will move into a red traffic light setting within 24 to 48 hours of Omicron arriving in the community.
Once Omicron arrives, though, we will need to step up further. That's why I'm confirming today that when Omicron enters into the community, beyond border-related cases, the whole country will move into red within 24 to 48 hours. We know from other countries that Omicron can take as little as 14 days for cases to grow from the hundreds into the thousands across the country. It is important to remember, though, that red does not mean lockdowns or regional boundaries, and business remains open. What it does mean is immediately increasing our use of masks, changing the way we interact in hospitality, and reducing gathering sizes in order to slow Omicron down.
A leading disease expert says the Omicron variant, which is spreading far faster than previous versions of the coronavirus, is not likely to help countries achieve so-called herd immunity against COVID-19.
Or you can visit our website, channelstv.com, for more updates, also a better understanding of the pandemic and other stories, breaking news at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.